I'm Michelle Sourjohn. I'm the Associate State Director of Community Outreach for AARP Oklahoma. And we are excited to be joined today with our speakers, Tina Jolly of Apila Solutions and Marilyn Connolly of OKDHS MIPA's program. And just a few housekeeping before we begin. Oops. There we go. You as viewers will be able to see the speakers and as well as their slides. The presentations should be closed caption. And we will have a Q&A session at the end of this session. So if you have questions, please put those in your chat and we'll be happy to get to those as well. But before we begin, I'd like to just share a couple of resources that we have available for you at AARP in regards to caregiving. In 2017, AARP, we did a caregiving survey that revealed 6 in 10 registered Oklahoma voters age 40 plus are currently providing care to an adult loved one or previously has provided care to an adult loved one. And 67% of those caregivers were women, and 1 in 4 are also caring for children. We developed several programs and resources for family caregivers, including a Prepare to Care booklet, which helps people understand key resources such as respite. We talked about those today. That help, and then also helps put together a care team. It also has wonderful different resources in here for national resources and organizations for you to contact and get help from. And then also it does have a workbook in the back that will help you do a general assessment with your loved one of their caregiving needs. And then also it's a great place to put all of their medical and financial information all into one place. So wonderful resource. We also do have the same resource guide for family veterans, service members, and their families. And then we also have a Medicare guide for family caregivers, because of caregivers were often the ones that are applying for those benefits for loved ones. And then we also do have our Oklahoma Caregiving Resource Guide. These are local resources of many of the community partners that you've seen today throughout this conference, and much, much more. So if you need help locally, we have these great resources available for you as well. And then we also do have our Home Fit Guide, which helps people understand what they can do to modify their home or their loved one's home so they can live in it as long as possible. And it's such a wonderful resource. And of course, we encourage people to think about those before you're getting deep into the caregiving journey. And then lastly, of course, what we're going to be talking about during this breakout session is that we have this wonderful guide for HR directors and for employers. We know that balancing work and family can be extremely challenging, and adding caregiving responsibilities to the mix dramatically amplifies that challenge. Over half of current and former family caregivers, which is about 54%, have been employed in either full or part-time as they provide care for their loved ones. And when this balance between work and caregiving becomes difficult, caregivers may need to make changes to their work situation. Many caregivers have had to adjust their work schedules to provide care. 2 in 3 say that they've gone to work late or changed their work schedule to help provide care for a loved one. And about 2 in 10 say that they've gone completely from working full-time to part-time so that they're able to provide care for their loved ones. So working caregivers, there's many that have reported that they've stopped working altogether so they can provide care because they don't feel like they can carry the workload and also provide care for their loved ones. And in fact, 3 in 4, 76% working caregivers say they have at least one of these 4, they've taken one of these 4 actions while providing care. So we know it's more costly to recruit and hire new staff than it is to maintain your perfect current stellar employees. And so AARP provides free comprehensive resources designed to aid employers and helping support those caregivers in the workplace. We do have these for small and large employers, and you can get that at aarp.org/employer caregivers. Or you can get all of these resources at no charge. You can contact me at AARP. I'm sorry, you can contact me at msourjohn@aarp.org. That's msourjohn@aarp.org. You don't have to be a member of AARP. You don't have to be 50 plus. There's no charge for these. It doesn't matter if you want 2 or 200 of them. You call us and we will make sure that you get those at no charge. So with that, I am super excited. We have 2 amazing issue experts today on HR and family caregiving resources. And our first speaker is Tina Jolly. She's founder and executive officer of Apela Strategic Solutions, where she leads a full service benefits, human resource, and healthcare consulting firm specializing in Native American sponsored health programs. She is a citizen of Choctaw Nation. She has a master's degree in both human resources administration and public health, healthcare administration and policy. Apela is the Choctaw word for help, and it's from the servant's heart that Apela was founded in 2018. So with that, I'm going to hand it over to Tina. Well, I'm going to pull up your slide.
Thank you so much for the introduction, and it's a pleasure to be with you all today. I've spent the last 30 years working in human resources, in the human resources profession, and helping supervisors navigate different issues with their employees as far as being caregivers, and there are a number. Next slide, please. And caregiving since the pandemic has only gotten more complex with balancing work, because many of us now, our workplaces are happening in our home, along with that caregiving. And understand, it's really important that employees understand the rights and what's available to them. Because as our former First Lady, Rosalind Carter, famously said, there are 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. Forbes shared that despite the hardship, 51% of current caregivers said that that the help that they were offering gives them a sense of purpose and meaning. Most caregivers surveyed said they also have full-time or part-time jobs. But out of all of those employees that were surveyed, only about 53% said that their supervisors were even aware that they had caregiving responsibilities outside of their work, which just goes to show that they could really use a lot of support in the workplace. And if you are a supervisor, I encourage you to reach out to Michelle and get the resources so that you can be available and equipped to help your employees as they go through and need these resources. And if you are someone who needs them, I encourage you to get those resources and give it to your supervisor to help them out. Next slide, please. Caregiving in the United States, the 2020 report of unpaid family caregivers. I think of an analogy like a duck sitting on the water where everything looks calm. But if you look below the surface, the little duck, it's paddling like crazy to stay afloat, right? And so I know that that is what's going on in the lives of caregivers, especially employed caregivers. And it's called duck syndrome. For those caregivers who are working full or part-time, this can be challenging, balancing your work life and your personal life. As a caregiver, you have to be efficient and organized and stay on top of the job while you're at work, and at the same time being available for whenever those emergencies happen or the calls that you're needed outside of work or you have to come into work late. The statistics that Michelle gave early on about 21% or 22% of 1 in 5 Americans being caregivers today. They're either providing care for their adult parents or adult children with special needs or disabilities. Currently, we estimate about 53 million adults in the United States are currently providing care to someone in their home. That's up from 43.5 million in 2015. The need for support for employees in the workplace just continues to grow, especially as we are still navigating our ways through this pandemic, which has been really difficult and adds to the struggle. Next slide, please. I'd like to start by taking a look at what's federally mandated. Currently, family medical leave, or you may have heard it referred to as FMLA, is a federal leave program that offers certain employees the ability to take unpaid leave for up to 12 weeks per year without losing their job, or health benefits to care for a spouse, a child, a parent with a serious health condition. FMLA does not cover to take care of in-laws, which is unfortunate. I know if you've watched the news, there's been lots of debates going on in Congress about paid leave versus unpaid leave. A lot of the developed countries in the world, most of them have a paid family medical leave benefit. The United States is one of the few that do not. You're covered under FMLA if you work for a public sector or a company that has at least 50 employees, that you work for your employer for at least 1,250 hours over the last year. And that averages out to be about 24 hours a week. Family medical leave and the Americans with Disabilities Act are probably the most well-known federal laws that address employee leave today. When you have a family member, I'm sorry? If you have a family member that needs for you to utilize family medical leave, you will be asked to provide for that family member. And there are deadlines that go with that. So be sure that you visit with your human resources contact to make sure that you get everything turned in the appropriate time frame to get approved for family medical leave. And what it does is it provides unpaid leave for up to 12 weeks per year to care for those family members. Next slide, please. Early on, the federal government provided a federal response to COVID-19. This was enacted in March. Unfortunate, and it was mandatory through the end of December 2020. After that time frame, this benefit became available on a voluntary basis. And so you would need to ask your employer if they are still allowing for the 80 hours of emergency paid sick leave in the event that you or a loved one gets COVID. But it's something that you should ask, because you could potentially get 2 weeks paid. And there is a tax benefit for them if they allow it. Unfortunately, many employers today have decided to, since it's no longer mandatory, to just stop the benefit altogether. But that's something that you could ask in the event that you or a family member gets COVID. Next slide, please. In Oklahoma, unfortunately, like many states in the United States, there are no mandatory benefit laws. Employers are not required to provide employees with either paid or unpaid vacation, sick leave, paid time off, or bereavement leave. However, most business owners know and understand that, one of the ways to attract and to keep their talent is to provide those types of benefits, because it builds loyalty among the employee population. I would encourage each of you to refer to your employees' handbook, because most of the time, a list of all of the benefits and the policies and procedures will be available there to show you what's available to you. Many times throughout a year, companies will do what are called benefit surveys, and they're asking what type of benefits would you like to have at your organization. It's a perfect opportunity for you to share what you need, or if you've heard about a benefit, to ask about it. And so those are some neat ways that you can get really neat discretionary benefits added. And many times when they are provided as part of a group package, the cost is significantly less than buying them individually. Next slide, please. And some of those discretionary benefits are catastrophic leave programs or voluntary leave transfer. Those allow employees to have a continuation of their salary and benefits while receiving some type of compensation during that period of need. Many employers have that available. You would just need to check with your HR departments. Also, elder care or long-term care insurance programs. Those pay for the cost of nursing home or in-home care or hospice type care for elders. Healthcare advocacy. Typically utilize phone-based counseling services that assist employees and their families in getting professional and medical advice on treatment protocols. And also, they're also able to help you research or understand which are the high quality, lower cost options that you have that are available to you on your health platform. Next slide, please. Another discretionary benefit, paid family leave. There are some organizations in Oklahoma that do offer paid family leave benefits. I would encourage you to check that out to see if your employer offers it. Most states, it's not mandated by most states. The one that comes to mind that is mandated is California. There's just a few other states that allow for that, but I would really, I'm hopeful that Congress will do something and at least get 2 to 4 weeks approved for paid family medical leave. Legal insurance, those are types of coverages where members are buy into like a legal shield type plan where you have opportunity to visit with counsel or legal representation for that help you when you're making difficult decisions. Telemedicine, that can reduce time and energy and cost of in-person doctor's appointments and help avoid putting the caregiver's job or earning risk at potential. I know some employers, especially small employers, may not have the flexibility in the workplace to allow you to take off. So if you have telehealth in your benefit package, I would encourage you to utilize those services. Many companies offer flex schedules or telecommuting as a way to balance the work-life issues that come up. 87% of organizations have experienced improved employee satisfaction. And some of the latest statistics, as we're coming out of the pandemic, many employers are choosing that to keep employees remote. And so maybe that's an option at your organization. And then self-health management. Those are programs that are embedded within your medical plans that are designed to encourage caregivers to take care of yourself. It's hard to fill up someone else when our cup's empty. So taking care of yourself, getting those checkups, making sure that you're healthy so that you can provide good, adequate care to others is really important. Once again, I would encourage each of you to definitely take a look at your benefit guides or talk with your HR team. Next slide, please. Another discretionary benefit that is very popular and many employees have this is an employee assistance program. I can't say enough good things about these types of programs. They're voluntary, they're employee-sponsored programs that offer very broad services to employees and help you navigate stressful and difficult life circumstances such as mental health, stress, depression, substance abuse, financial concerns, family issues, well-being, and legal matters. Typically, most of these are done either online or over the phone, but it's an excellent avenue that allow access for different things that are going on in your life. I've utilized these types of programs and they're amazing. When we talk about caregivers, you know, caregiving can be emotionally and physically demanding. 14.5% of caregivers reported experiencing 14 or more mentally unhealthy days a month, which means half of the month they feel unhealthy. 17.6% of caregivers reported experiencing 14 or more physically unhealthy days. You know, when we are stressed out, in many cases, it manifests itself in a physical way. Reaching out and utilizing these employee assistance programs can help take the edge off of some of that stress and give you coping skills or resources that will help you navigate those difficulties of life a little more efficiently. Next slide, please. The National Alliance for caregiving partners with other caregiving associations and groups to provide additional resources to help family caregivers address and cope with the challenges of caring for loved ones. I want to leave you with a word from Amy Goyer, the AARP's family and caregiving expert and author of Juggling Life, Work, and Caregiving. If you're a caregiver, it's okay to not be perfect. Success is not about preventing every loved one's fall. There are certain things beyond our control. Success is simply being there to care for your loved one. Thank you so much. If you have questions, please let me know.
Tina, there was a question in chat.
Okay.
Someone asked, how do they find a healthcare advocacy organization that could assist them in finding an assisted living facility for a relative?
If they want to email me, I can help them navigate the resources that are available at their within their employer arena and help them decide which might be a good fit for them.
What's your email address? And I will type it in chat.
It's TENA.Jolley, JOLLEY at Apela, APELA solutions.com.
Thank you.
You bet.
Great. Thank you so much, Tina. We appreciate you and your expertise. We also have Marilyn Connolly from Oklahoma DHS Community Living and Aging and Protective Services MIPAS program, which is the Medicare and Medicines program, where she works helping the most vulnerable group of Oklahomans with their medical expenses. I'm going to hand it over to you, Marilyn. Thank you so much.
Thank you. So glad to be here today. I'm going to get my slideshow ready real quick. Bear with me on this one. There's my share. Okay. Let me get this going here. There we go. Now, hopefully you can see a screen. Can you?
Looks great.
Does it? Okay, great. Well, it's a success. Okay, I was introduced earlier. I am Marilyn Connolly, and I'm with the MIPA program. And I work for OKDHS, and our aim and goal is to reach out to senior citizens and the disabled to help them with their needs and with prescriptions. We are really trying to help low-income Medicare recipients that may be able to help them save thousands of dollars on their Medicare Part D premium and prescriptions. And as we all know, prescription seems to be getting a little higher every month. MIPA, the Medicare Improvements for Patients and Providers Act, is a federal grant that was passed in 2008 to provide extensive outreach to connect with the low-income Medicare recipients and the disabled that may need help in assisting with their Part D premium and prescription drug expenses. And again, as we're focused on the older adults and individuals with disabilities. MIPA provides valuable support to the Medicare beneficiaries that have limited resource and income. It's low income subsidy program, and it's LIS, and we refer to it as extra help, and it is a federal program. Another possible benefit for low income seniors and the disabled is the Medicare Savings Program. And that program is provided by the state, and it pays for the Medicare monthly premiums that are $148.50 a month. And that covers your Part B premium. Thereby, it would increase your monthly check by that same amount. In 2021, Social Security Administration determined that Oklahoma had potentially 14,304 Oklahomans who were, or maybe were eligible for extra help. With an average savings of $4,900 for individuals, that would equate to $70,089,600 if all Oklahomans who were eligible were enrolled. And the savings would allow those individuals to have purchasing power to get necessities, which in turn, the funds would go back into the Oklahoma economy. There are several benefits of LIS Extra Help, and here's a listing of a few of those. It pays some or all of Part D premiums. It pays some or all of your annual deductibles. It pays part of the prescription drug copay or co-insurance. It is continuous open enrollment for Part D. And there's no late enrollment penalty premiums. And that is really important when you are eligible for Medicare. If you don't select Part D, you will have lifelong penalties that you will pay when you pick up coverage that will cover your prescriptions at a later date. And that's not often, you don't often get that information when you are actually enrolling. So that's really important. And you can change your plan at any time. There are a couple of eligibility criteria for extra help, and the first one is the income limits. If you are single, your annual revenue cannot exceed $19,560. And most people work on a monthly amount, and that would be $1,630. If you're married, your annual income cannot exceed $26,376 a year, or again, per month, that would be $2,198 a month if married. And there are several things that we do collect to see if someone is eligible. And that would be your Social Security check, any veteran benefits if you have veterans assistance, any pensions, any earnings, say that you maybe are you're self-employed or maybe you're still working part-time, that would count. Railroad retirement benefits, or any other income such as rental income. That would all have to be collected and counted as income. The second eligibility requirement for extra help is your resource or asset limits. And again, if you're single, you cannot exceed $14,790 a year if single. And for the married, it would be $29,520. Now there are some exclusions on this one. And the first one is the home you live in and the land that it is on. Your vehicle, back payments from Social Security and SSI, any personal possessions, life insurance, burial plots, an irrevocable burial contract. And if you're not familiar with that would be if you've prepaid for burial expenses. That would be excluded from your resources. For assistance with the Medicare Savings Program, you can contact your DHS office, or you can contact our local, the main number that we have, which is 1-855-880-8003. Or if you have a computer, you could reach out to okdhslive.org, and you can find the information for the Medicare Savings Program. And as I mentioned earlier, that is the state program, and it would pay for your monthly Part B premium of $148.50, thereby increasing your monthly check by that same amount. Well, we feel that Medicare has gotten a little smarter, and they have figured out that it costs less to prevent medical issues than it does to cure health problems. So on this next slide, we encourage everyone to be proactive with your health. And this listing is of free preventive health services that are provided by Medicare. Many of them on this particular slide are at 100%, and there's many more. And it doesn't matter what your income or your resources are, it is totally covered by Medicare. But it is important that you check with your doctor to make sure he takes a Medicare assignment. Now, there are other services that are also provided. Real quickly, we've got the diabetes screening, and it's available every 12 months. But if you're pre-diabetic, it's available every 6 months, and that's covered at 100%. Bone mass measurements. It's once every 2 years, unless medically necessary. And again, it's covered at 100%. These are really important as we get older, that we follow our health and we check up on our wellness. There's a wellness exam that's also covered at 100%. The next slide will show a few of the services, and this is just a sampling of the services that are available. You can get on the Medicare website and you can check out the full range of services that are available. But again, here's a few listings here that are covered at 80%. And that means you would have to pick up about 20% unless you have a Medigap or a Medicare Advantage plan, and they could help with those extra expenses. Otherwise, you will be out of pocket by 20%. You could be out of pocket 20%. Well, if you're not confused with Medicare, and I certainly found it confusing at first, we have a state agency called SHIP. It's the State Health Insurance Counseling Program, and that's just what they do. They provide assistance to beneficiaries with information counseling and enrollment assistance. And they will just go over your particular situation with you, find out what your needs are, show you what's available, and just give you a little guidance. I certainly needed it at the time when I signed up. And so that number to contact them is 800-763-2828. And I want to mention again, it is a state agency. It's a nonprofit agency. They're not going to try to sell you anything. And the last slide is a representation of our state that illustrates how the state is divided up. And the matching colors on the left side represent the coordinators that are assigned to those areas. We have 5 coordinators who work part-time, and you'll find their contact information on the left side with their name, phone number, and email address. And if you'll notice at the bottom of the page or the slide, there is our website, okdhs.org/Medicare and Meds. And you can find out additional information there if you have a computer available. Again, if we can be any of assistance to you, the caregiver, or to the loved one you are caring for, please reach out to us. We'll be glad to help you in any way we can. And again, I'm Marilyn Conley, and I'm the coordinator of the Southeast Quadrant of the state of Oklahoma. And if we have time for a few questions, let's see if we have anything.
Great. You can
Sure.
put your questions in chat, or you can unmute yourself and ask your question.
Maybe I explained it so well.
Do we have any questions for any of our speakers today? Okay, well, please, if you do, Lori and Kim shared our email addresses. So please feel free to reach out to any of us after this presentation if you'd like some additional resources or you have a question. We certainly appreciate you, Marilyn and Tina, for joining us today and sharing your expertise and these incredible resources. We refer people to SHIP almost daily. It is a great resource, you know, and we've talked to so many people that it saved them a lot of money. So
It's so very confusing.
it is very confusing, and you know, I mean, that's what they're there for. It's our tax dollars that pay for that great resource, and they can help you whittle that down for your loved one or for yourself to figure out what fits your pocketbook the best.
Let's give away the gift card for attendees.
Yes.
And so the winner of this breakout session gift card is Bill Kinnaman. And I show that Bill is still here with us. Bill, if you'll just unmute yourself or type in chat, you're here, we will get you the gift. And it is a $50 Walmart gift card.
Congratulations, Bill.
Yeah, congratulations.
And I saw Bill, I checked my email as we're here, and he's always reached out for the resources, and we'll be glad to get those to you as well, Bill. So thank you so much. Well, Lori and Kim, thank you so much for your support and making sure that this session ran very smoothly. Marilyn and Tina, thank you for sharing your expertise and your resources today. For all of you attending, please reach out to all of our partners at OK Cares to access any of the resources that we talked about today, or if there's some more need that you have, reach out to us. We all do work together to make sure that we are connecting people to the resources that they need during their caregiving journey. So again, we appreciate you for attending today's conference. We hope that you enjoyed it. We look forward to your feedback, so please fill out those feedback forms for us. We do take those into consideration as we start planning for next year. So appreciate you so much. Thank you.